It is a very good evening. We welcome you all to this program. This is Health Thought. Edwin Austin Muhalas is my name, of course. And as usual, we are with our sign language interpreter, Fatina Galenda. But always remember that the lives of those young ones matter a lot. Just come to think of a situation where your parent didn't take good care of you, where your parent had not taken good care of you, and then what would you have been? So, you too have a responsibility of taking good care of that young one. That is why the School of Public Health, Makerere University, came up with this show, together with Family TV, so that we can help you mentor that young one, that child that you are about to bear, or that child you have already given birth to. So that is why we are always here. The moment it clocks 7 at your watch, just know it is Health Pod, and only on Family TV. But of course, as usual, we have our member on the panel today, and she is Dr. Victoria Nakibuuka. Doctor, we are so glad that we have you today in today's show. Kindly greet our esteemed viewers.
Good evening, viewers. I'm Dr. Victoria Nakibuuka Chilabira. I am a pediatrician and neonatologist. I work at Zambia Hospital. Thank you very much.
Yeah, we are delighted that we have you. So since she is a newborn specialist, today we want to look at what we call early childhood development. Remember when we hosted Dr. Peter Waiswa, who actually gave us an overview of this program. He told us that we are basically looking at maternal health and early childhood development. So today we want to look at an aspect in early childhood development, and that is why we have Dr. Victoria here with us. Doctor, we want to talk about these young ones, and we want to basically talk about some of the things that enhance their development, their growth and development. And maybe if we start with, I would like you to talk about the environment. Which kind of environment favors these young ones?
Since I'm a newborn specialist, I am going to practically talk about an environment that enhances growth for preterm babies. When babies are born as preterms, when the baby is in the mother's womb, this baby is protected. So this baby is in the womb, which is surrounding the brain, and within it there is an environment which has the right temperature, the right kind of noise, the right kind of warmth, the right kind of nutrition that is going to enhance appropriate development of the brain. But once these babies are born, that environment sometimes may be disrupted, and this may actually affect how this baby can grow later on in life. So when we look at preterms, we are not only looking at how to make them survive.
Maybe, Doctor, we start with the word preterm. What is preterm? What do you mean by preterm? Because our mother out there may not be understanding the word preterm.
A preterm baby is a baby that has been born before their scheduled time of birth. So we know that any pregnancy is 9 months. So any baby that is born less than 9 months is called a preterm baby. So that is the definition of a preterm.
The ones we commonly know as prematures?
Yes, prematures. Okay. Yes, I think that is the word, prematures. So we are looking at this baby when they're still in the mother's womb. They are well protected. They have the right temperature. They have the right kind of nutrition. They have the right kind of noise. Everything is appropriate for them to grow. So when they come out, the idea would be to simulate such an environment so that they can be able to grow. And like when these babies, we have them, we should not only aim at making them survive and they don't die, but when they have survived, can they become doctors like you? Can they become journalists? Can they become engineers? Can they become nurses? Can they become somebody that is very important? So as we nurture these babies in our neonatal units, it is important that we pay attention to certain things that can enhance brain development. It's good, we can make them survive, but it's important that we pay attention to the things that can make them have better development later on in life. So as I said, when the baby is in the mother's womb, they are cautioned against so many things that enhances appropriate brain development. And some of the things that may affect how this baby may grow, of course, this may be infection. If the baby gets infection, so it may affect how the baby is going to grow. So once they are with us in our units, we have to ensure that we have appropriate infection control. We treat the infection appropriately so that it doesn't affect the baby's brain. The other thing is adequate nutrition. When this baby is in the mother's womb, there's food which is coming from the placenta. That food has enough protein, it has enough carbohydrate, it has enough fat. All those things are enough to make the brain grow. But sometimes when these babies come, they're still young, they may not be able to tolerate enough food, like the milk. And sometimes even the mothers don't have enough milk. So if we don't pay attention to adequate nutrition of these babies, they may survive, but they may never reach their full potential because we have not fed them adequately enough. So
I think, Doctor, like you said that we pay attention to the nutrition.
Yes.
And we look at a situation where our mother out there is finding a challenge, or she doesn't have breast milk. She's actually unable to bear breast milk. So how can we deal with nutrition in such a situation? Because we know this breast milk is packed with all these nutrients.
Okay. As breast milk is one of the best things that can enhance brain development, because there are certain components in the breast milk that are going to make the brain grow compared to other kinds of milk. And I'm particularly talking about a premature baby, probably in a hospital environment, maybe before they go home. So, of course, we have to find a way of how we can assist this mother. One, create a conducive environment for the mother to ensure that she can express breast milk. Educate the mother about breastfeeding. Educate the mother and calm her down. Because when a mother is stressed, if a mother is worried, she cannot be able to give breast milk. Educate this mother about adequate nutrition. Because what it's going to affect, in one way or the other, the quality of the milk that she's giving the baby. And this brain, the baby's brain, grows fastest almost in the first 1 month. And later it is going to, they'll just be additions. So if the baby's brain doesn't grow in the first 1 month, it is going to basically affect this child for the rest of their lives. So if we educate these mothers about breastfeeding, expressing breast milk, and creating an environment where they're not so stressed, that may also help them to be able to get involved, to ensure that they have adequate nutrition, adequate breast milk for these babies. So I talked about nutrition is one of the things that we really need to pay attention to. Adequate nutrition, especially breast milk for a preterm or for any newborn. Breast milk is something that we have to pay attention to because that is going to enhance brain development. Some studies actually have been done and they compared babies that were breastfed exclusively for like 3 months, and then they compared it with babies who had been breastfed, and they looked at the sizes of the brains at about 3 months, and they noted that the size of the brain of a baby that was exclusively breastfed was bigger at 3 months than the baby who was not exclusively breastfed. So meaning that breast milk and nutrition play a very important role in early child development. So for these babies, especially the premature babies, we have to pay attention to the nutrition in the hospitals. Don't keep these babies on drips for a very long time. See that the mother can express breast milk. And let us give adequate amounts of breast milk, so that by the time the baby leaves the hospital, they have attained an adequate weight gain. Plus the head circumference. The head circumference should also be increasing. When these babies are discharged, we need to plot and say, does this baby's brain head circumference correlate with the age of the baby? So if you have discharged the baby and the head circumference not correlating with the age of the baby, that means this baby may be a problem later on because the brain has not grown adequately. You have to pay attention to the nutrition, you have to pay attention to the infection, then you also have to pay attention to the circumstances around, noise. So these babies, when they're in the mother's womb, they're like in a cushion.
Yeah.
You have there is that water, there is the womb, then the mother's fat. So all this cushion, the amount of noise that is reaching this baby. Sometimes in our units, the people speak so loud, everybody's shouting, the incubators
and sometimes
are shouting.
You can't stop people from talking.
But it's important when people know that if you're in the neonatal unit, there is a preterm baby whose brain is still growing. So it's important that maybe we have to lower our voices. Still another study was done and they're looking at noise levels in the NICU. And they found that the noise levels were very high in the staff rooms when the people go for break. So they were shouting a lot, and if the noise levels are not controlled for a certain level, they can affect the baby's ability to hear, because this baby's ear is just growing. So, and then the light. So when this baby is in the mother's womb, she is cushioned. The light is not so bright. So sometimes this baby sleeps, there's too much light. So we have to sort of control the amount of light that is even coming to the babies. So, and the other thing, sometimes we parents, sometimes we are not involved, especially sometimes in the hospitals, in care of the baby, especially some of these private hospitals. The mother goes home and the baby stays in the hospital.
Maybe it is the setting of the hospital.
We are now trying to advocate to see that the parents get involved in the care of these babies.
Why is it important that the parents should get involved?
It's very important. One, when this baby is growing, the baby knows the voice of the mother, even when they're still in the mother's womb. So if this baby is in the unit, even listening to the mother's voice may calm the baby down. That calming environment is what we need for the brain to grow. The other thing is
maybe, Doctor, we are breaking for a short, we are going for a commercial break, but when we come back, we are going to start from there, because this information is really important for all mothers out there. Welcome back from that commercial break. Remember, this is Health Pod. This program is always airing on Friday at exactly 7 p.m. Of course, this is the second session. You who didn't start with us, you was just tuned in. Yeah, we are already here, actually already started. And we are looking at what we call how to enhance what we call development or early childhood development, specifically in the preterm babies or the ones we commonly call prematures. And we are with Dr. Victoria Nakibuuka, and of course she's taking us through the entire process. Doctor, we are looking at the kind of environment that these children, these preterm babies need to be in, and you have told us a few aspects. One of them was noise and nutrition and light. So what else what else fosters their development?
Okay. The other thing that is very simple and it's not expensive, what we call kangaroo mother care.
Maybe, doctor, before we continue, before we went for the commercial break, we are actually looking at why it is important for the mothers to be part of this whole process and not leaving it for the health workers.
Okay, parental environment.
Yes.
Yeah, parental environment in the care of a preterm baby or a premature baby is very important. It enhances brain development. And as I said, when a baby is in the mother's womb, they know the voice of the mother. And already there is an attachment between them, that mother and the baby. So just that baby hearing and listening to the voice of the mother calms this baby down. That is the environment that we need to ensure that the baby can grow very, very well. The other thing, like even the smell of the mother, when she smells the breast milk, that itself alone can be able to calm the baby down. Whereas me as a health worker, I'll come and feed the baby, but the mother's involvement is very good. And then if a mother is with this baby most of the time, the mother or the father is going to learn the behaviors of this baby. If this baby is hungry, how do they behave? If this baby wants to sleep, how do they behave? If there is something that is paining, how do they behave? So then they're able to offer an appropriate intervention and reduce on the stress on the baby. And once they have less stress, then you're going to enhance brain development and better coping mechanisms. And you know, parental involvement is very important, because I think previously most, even in the industrialized countries, they were looking at nurses and health workers doing most of the work, but that is shifting. And some people actually have done studies when they have involved parents in the care of the preterm babies or premature babies. These babies have less days of hospitalization, meaning that the parent is more confident in handling the baby, other than leaving the baby with a nurse, with a health worker. And then for the moms, they have better breastfeeding rates. They have increased production of breast milk. Remember, we said breast milk is what we need to enhance the baby's brain to grow. So if the parents are involved in the day-to-day activities like changing diapers, feeding the baby, cleaning the baby, there is a better bond that this baby is having with the parent, and this enhances the bonding and better brain development. Remember, this baby is going to be with these parents for a very long time. So if they start the bonding early now, chances are, even as they are growing, whether the child is 1 year, 2 years, or an adolescent, there is that bond that has already been created.
So meaning, doctor, bonding can even take place to the preterm babies?
Yes. So if the mother is leaving everything for the nurse, she doesn't have an attachment, and even the baby doesn't have an attachment. So that a parental involvement is what we are also pushing for and advocating for, creating awareness that let parents be involved in the care of these babies, not only for themselves, but also it enhances better development for this baby later on in life as the baby is growing. So we need parental involvement in the care of the baby. It should really be involved in feeding the baby, changing the diapers. Once the baby is dirty, the parents should be involved. They shouldn't leave this baby to only the health workers. It's their role, because it enhances bonding and better development for the baby.
So I think, Doctor, now we get back to the other aspects that actually foster or enhance the development of this preterm baby. Yeah, besides the ones that we have talked about, you have told us there is something else that is simple.
Yes.
Yeah, what is that?
Kangaroo mother care. Kangaroo mother care is something that we really need to to really utilize and explore and make sure that you use it to the maximum, especially for these babies, the premature babies, because once they're being stable. I work with newborns and I work with preterms. When mothers do adequate hours of kangaroo mother care, like 10 hours or more, it is amazing. You can see these babies, they start having weight, they start smiling in the incubators. When a baby starts smiling, that's already showing you that the baby's brain is really growing. So it is amazing how simple it is, but how it has so many advantages.
So doctor, what is this kangaroo mother care?
We have not maximized. Kangaroo mother care is a simple procedure whereby you get the little baby, you undress them, and you leave baby just a diaper, and then the mother opens up her chest, and you put the baby in the chest, and then you sort of put a nice cloth and tie them around. So remember this baby. Remember what enhances growth of the brain. You have to simulate an environment like the womb. So if this baby is with the mother, she's curled around the mother. There is that warmth, the tickling kind of sensation, and the calmness. So it really calms the babies down. It has been studied. It regularizes the baby's heart rate. It regularizes the baby's breathing rate, and even the sleep. When a baby is in a kangaroo position, they sleep better. It's like when you don't have enough sleep in the night, the following day when you're doing your work, you don't have enough concentration, or you're going to make a lot of mistakes. So the same thing also reflects on these babies. When they're sleeping, if there is that deep sleep that they get, that is when the brain is growing. You have the cells dividing and growing very fast. So kangaroo enhances that very good sleep. That is very good to make the brain grow. The longer the mother does it, the longer she does it, the better for the baby. And what do you want? You don't want a baby to survive, and their IQ is low. Yeah. You don't want a baby to survive, and they're just like that. So we need to keep talking to enhance better development of the baby's brain. We have to enhance. And one of the things we can do is to maximize the hours of kangaroo. I also refer to another study research that was done. They did a study, and when they compared babies who had kangaroo for more than 10 hours or more, by the time the babies were discharged, the head circumference was like 0.2 centimeters bigger. And the head circumference at the time of discharge determines how this baby is going to have grown at 1 year. So there are things which we can employ in our units to see that we are not only looking at survival, but to see that these babies can grow appropriately. One of them is kangaroo. So
doctor, is it only mothers that are supposed to do the kangaroo mother,
not the
or
father.
even the father?
You can also do kangaroo father
because if actually it is only the mothers, then it is a bit unbalanced.
No, you can also do the kangaroo
as a father.
Yes, the father. If the father has time, usually what happens, the men look for money, and then the women are there. You have maternity leave. The maternity leave for a man is about 1 week. Maternity leave for a mother is about 3 to 4 months. So, but the fathers can also assist. I'm not saying not only the mothers, they can also assist. So kangaroo has a very big benefit, especially for preterm babies, premature babies, to enhance that childhood development. I think in the city where they started kangaroo, that was in Colombia or Bogota, they followed up these babies up to, I think, either their early 20s, and they also still noted the brain, when they did the different studies, the brain for the babies where they're done kangaroo were bigger than the ones where had done kangaroo for a long time. And they also noted that these babies where they had done kangaroo for a long time, they had close attachments to their parents, and they were less likely to drop out of school, and they had good temperaments. They were not so irritable and all that stuff. So it has very many advantages, and yet it is simple. It increases weight gain. It increases breast milk production for the mother. So those are things that we can maximize in our units. At night, if maybe allow these babies to sleep If they can sleep, that is good, because you want them to grow. And sometimes we are talking so much in the units, and at night we're shouting, and even we need to limit the amount of noise and even the lights that we put upon these babies. So those are some of the things, and of course, the parents have to be involved in the care of this baby. They have to be involved. They have to be involved. If you have to enhance their development, because if a parent is not involved from the beginning, then when the baby is growing, it may also be difficult for this parent to be involved. So it's important that parents are involved in the growth of these preterm babies.
Okay. Doctor, I'd also wish to ask that in development of the preterm babies, you talked about what we call brain development, and you say that the brain development takes something like a month. So is it the same? Is it the same with the other babies who are not preterm?
What I was trying to say that when you look at the size of the head, the biggest size it occurs like when at birth, our head, the size of our head is about 33-35 centimeters, and by the time we are just 1 year, it's like 47, meaning that you've added about like only 12 centimeters. So when this baby is born, in that first 1 month, that is when you're going to get the 33. So you want to maximize that time, because that is the time when you have the rapid development of the head. And if we miss it, it's like the head is like a computer, or the size of the computer. How much storage can it have? So the size of the head, the brain, determines the amount of storage or the amount of knowledge or memory that you're going to have. And it grows fastest in the first, probably, for preterm, because the baby is born before birth. In that 1 month, the baby is trying to catch up to become like a term baby. I hope I've been understood.
Understood. Yeah. And then maybe as we wind up, I'd also ask, why is it that most of these preterm babies, after discharge in hospital, they constantly fall sick? Some of them.
Well,
after being discharged from hospital, they still fall sick constantly. And actually, out there, it has become a belief that if your child is preterm, then they'll always be in that state till their old adulthood stage.
Well, as I said, as a preterm, they have been born before their time of arrival. So there are certain things in their bodies which may not be very strong enough to fight against infection. Like the immune system, it comes out, it's young, so the baby will be prone to infections more compared to a baby that has been born that is term. And then the other thing is also they tend to have issues like the lungs are not well developed, so they tend to be dependent on oxygen sometimes for a long time. That makes them to have a higher risk of having sometimes respiratory infections compared to the other babies. But the other thing that maybe we health workers should do is probably want to educate our mothers when we are discharging them. If the mother is properly educated in terms of caring for these babies, they are going to have less infections. One of the things we need to ensure is to ensure that we have adequate nutrition. Have enough breast milk. When you're giving this breast milk, what is your hygiene? Ensure that your hands are washed when you're going to express your breast milk. Make sure that the utensils where you're going to give the milk, they are clearly washed and they are cleaned, so that you can prevent infections. And then also you want to prevent crowding. If you have a preterm baby, you're not going to get visitors, the whole village coming to visit a preterm baby.
The African way.
Yes, let this baby be kept in the bedroom until maybe she's about 2 or 3 kilos for the other people to come and see. So you have to try and do also some preventive measures so that you can reduce on the rate at which the baby catches infection, because they're vulnerable because of their state of being preterms.
Thank you so much, Dr. Victoria. We're indeed grateful. Thank you so much for elaborating about the preterm babies, because we sometimes we can't do about it. Our hands might be closed, So sometimes circumstances force mothers to have preterm babies. But of course, when you have a preterm baby, that is not the aim of this baby. This baby too has a life to live. This baby too has a future to live. Therefore, take caution. Listen to the advice given to you by the health workers. Those people attending to that baby will always advise you, like doctor has told us, that the nurses will always advise you, especially when it comes to handling this particular baby. Thank you so much, you who started with us, and you who has been following, you who started with us from where we started this program from. But of course, a credit goes to all the team that sits behind, or the brains behind this whole preparation. And that is the team from Makerere University School of Public Health and the team from Family TV. Of course, Edwin Austin Mukalas is my name. Fatina Galenda is our sign language specialist. Jonah Jab, the producer. We have Tony Santo on social media, and we have Bantam, who is in transmission. Thank you so much. Enjoy your weekend responsibly, and good night till we meet again next Friday.